Everyone, I'm Asma Saeed from the Policy Advocacy on Genetics and Genomics course. And today I'll be representing Team E, the Affirmative Team from Group 3. And we will be exploring together whether integrating genetic information into national health databases can improve public health planning and also discuss the associated privacy concerns. Before I start, I only want you to imagine Africa with healthcare systems that can predict and prevent diseases before they manifest, where treatments are tailored specifically to our African genetic profiles, replacing the old one-size-fits-all approach with the new precision medicine concepts. We stand firmly with this because we believe that this can ensure the highest treatment efficacy with the minimal side effects. Now let's talk about accessibility. Did you know that integrating genetic data in electronic health records can enhance precision medicine and also cut healthcare costs? For instance, the treatments like Herceptin, which was found to be effective in breast cancer patients who have the HER2 gene, could be more precisely integrated if we had genetic databases. Also, let me show you some initiatives that started enhancing the concept of precision medicine here in Africa. These initiatives are actually making strong strides in genomics by providing frameworks and policies for precision medicine. Such initiatives are the HS3 Africa, 54 gene, Trepano gene, and also the Uganda Uganda Genome Resource. These initiatives are focusing on understanding the genetic determinants of disease in the African population and also developing targeted intervention that can support precision medicine in combating NCDs and infectious disease. One major concern for genetic testing is the accessibility for data and testing here in Africa. Well, we believe that this can be tackled by investing in development and strengthening of the electronic health record system or infrastructure across the African countries. As you can see here, that many African countries now have electronic health record system. However, we need to strengthen these health systems in order to support the complexity of genetic data. Example for countries that already have the health record systems are the Rwanda, they have the open medical record system, Kenya, electronic medical records, district health information system too, which is already implemented in Ghana and South Africa. And another concern that was raised is patients cannot access the testing if they cannot afford it. Yes, it's true. Therefore, governments should establish funded genetic testing programs that can make testing affordable and accessible to all citizens. This also should be going hand in hand with advocating for the inclusion of genetic testing in health insurance coverage, which can ensure that both public and private insurance plan cover the costs for testing and counseling. A well-known case study for this is the South African government, where it funds the genetic testing for specific conditions such as cystic fibrosis, thalassemia, hemophilia, through public healthcare programs that subsidizes the cost of genetic testing for patients who cannot afford private healthcare. Another major concern for genetic testing and the implementation of genetic testing is the acceptability, religious beliefs, and the cultural concerns here in Africa. One study that was conducted in the Western and Central Africa, whereas they assessed the acceptability of the public regarding the genetic testing programs, and out of the 3 known genetic testing programs, such as the newborn screening, premarital screening, and preconception, it was found out that the newborn screening was more acceptable to the public than the other two approaches, which supports the idea of like starting with what's acceptable in the culture or in the country and take it from there by implementing the other new approaches. We believe that it's not like a one-time thing. It's something that should be done in steps in order to like meet the expectations and the acceptability of the public. In addition to that, policymakers should involve community leaders, religious figures, or respected individuals within the community to develop culturally sensitive and acceptable genetic testing programs, in addition to awareness campaigns and educational materials, which all support to normalize genetic testing and reduce any misconceptions that the public have. Besides that, we need to integrate genetic testing and counseling into routine healthcare to normalize that these practices are already available in the healthcare system in order to reduce the perception of them being exceptional or only for those with serious conditions. Furthermore, involving healthcare workers, religious leaders, when counseling couples who are at risk of having a child with any sort of genetic disease, in order to improve adoption and acceptability of genetic testing. On the other hand, we need also to support the establishment and operation of advocacy and support groups for individuals with persisting genetic conditions in order to provide education, emotional support, and platform to share experiences and reduce the feeling of isolation or stigma if exists. And this also brings us to how can these all be effective? So one study reported by Tindana and his colleagues, they said that they found effective community engagement strategies such as the town hall meetings, community gatherings, focus group discussions were successful for the implementation of genetic studies in Africa. So we need also to consider these different types of engagement strategies during developing our policies. In addition, implementing community-based participatory research approaches to involve communities in genetic research and education was also one of the recommendations of the American Society of Human Genetics, where they reported that the community-based participatory research is one of the best known community engaged research approaches that were adopted for genetic research and education. Because most of public or normal people, they will trust the pharmacist in their area, the nurse in their family. They will always go for people they trust, people who are among them. So this is a very, very important thing to keep in mind while developing policies, that you need to start from the closer people, or to start from inside the population, from the people they trust more. Okay, and then moving out to another concern, which is the privacy concern. Developing and enforcing comprehensive data protection laws specifically addressing genetic data should ensure that genetic data is collected, stored, and used ethically and securely. This is why countries like Kenya and South Africa have already established data protection laws, such as the Kenya Data Protection Act that was published in 2019, and the South Africa Protection of Personal Information Act that was developed in 2013. These all need to be expanded to include other countries and provisions for genetic data. Additionally, implementing robust legal protections ensure genetic data is used ethically, securely, and prevent any sort of misuse or discrimination. And a very well-known example for this is the GINA Act in the United States, which prohibits genetic discrimination in health insurance, employment, and also protects individuals' genetic privacy. Furthermore, implementing stringent data protection measures to ensure the confidentiality of genetic information, using tools like encryption or and even restricting the access to personalized to authorized personnel only will make public more comfortable with sharing this data or like support their acceptability for genetic testing. And some of initiatives that fully support the data protection measures are the HIPAA in the US, whereas they set national standards for the protection of health information, including genetic data, and also confidentiality and encryptions were already implemented by the Decode Genetics project in Iceland, whereas they use de-identification methods to protect individuals' privacy while conducting large-scale genetic research. Moving on to concerns raised regarding the informed consent and transparency. So this can be addressed by providing a fully informed consent, physicians, investigators, and whoever is using or providing a patient with information related to genetic data or convincing them to do genetic tests, they need to fully inform the patient about their genetic data, how it will be used, all the risks, benefits, and the outcomes that will be coming out of this, and also to provide opportunities to them to consent or opt out at any time. A successful story for this is the UK Biobank, whereas they require participants to provide informed consent explaining how their genetic data will be used and ensure transparency throughout the process. Also, countries can adopt guidelines similar to those that provided by the H3 Africa Consortium, which emphasize the importance of informed consent and the ethical use of genetic data in research. Additionally, physicians and public both need to have genomic literacy. They need to understand why are we doing these tests and how can we interpret these results. And in order to support or like enhance this genomic literacy, we need first to develop and implement comprehensive educational programs to improve the genomic literacy among the healthcare providers by offering them specialized trainings and certification programs in genetic medicine, which can be supported by capacity building. And a very well-known example for this is the Genomics England education program, which provide resources and trainings for healthcare providers to improve their understanding of genomic medicine and its clinical applications. Additionally, there are now technologies that support the interpretation of genetic data and clinical decision-making, such as technologies such as Myriad Genetics the experiences of physicians with the genetic technologies and genetic data interpretation and decision-making during their clinical settings. Also, in order to educate the public about genomic data and genomic testing, we need to launch public awareness campaigns in order to educate them about by starting to teach them about genomics, different types of genetic testing, and the implications of the genetic information. The public announcement, a very well-known example for the impact of having influencers and advocates in public health is the Angelina Jolie influence about her BRCA1 mutation and preventive mastectomy. It was shown that it has led to an increase in genetic counseling and testing for breast cancer by 90% after 6 months of her announcement, which also remained high 1 year after after, um, 1 year after her announcement, with an increase of 88% from baseline. This also brings us to the last point, which is advancing genomic research for public health. So we need genomic research to be conducted here in Africa in order to enhance epidemiological studies to provide more insights into the genetic factors that contribute to diseases in Africa, and also to help speed up the discovery of new treatments. Another success story that was implemented is the UK Biobank, which is a large-scale biomedical database that includes genetic data from more than 500,000 participants. This resource has enabled numerous studies on the genetic basis of disease such as diabetes, heart disease, and various cancers. In Africa, we are still in the early phase of this implementation. However, we started to have different African genome projects that were launched recently, such as the African Genome Variation Project that was launched by Sanger Institute in order to provide a basic framework for genetic disease studies in Africa. And also, some African countries have developed their genome projects, such as the Southern African Human Genome Project, the Egyptian Genome Project, and the Nigerian Bioinformatics and Genomics Network. These are all in their early phases. However, we believe that one day we can have our genetic databases, we can have our good understanding of the genetic determinants of disease in Africa. And this will lead me to conclude this presentation by saying that the integration of the genetic information into national health databases holds immense promise for advancing public health and personalized medicine. We can harness the full potential of genetic data to improve health outcomes and public health planning, creating a healthier future for all Africans. And I will end my presentation by President Bill Clinton quote in 2000. When we had the first Human Genome Project, he said that genetics has the ability to revolutionize the diagnosis, prevention, and treatment of most, if not all, the human diseases. So let's hope for the best by integrating the genetic data into our national health databases. Thank you so much.